Dr. Eswaran, you touched a bit on this before, but I think specifically a lot of patients want to know, does IBS cause IBD? Does it cause cancer? Does it increase my risk of dying early?
Yeah, it's a really common question and a common fear that I hear from patients. And inflammatory bowel disease, or IBD, is not the same as irritable bowel syndrome or IBS, but it sounds very similar and they're often confused. And in inflammatory bowel disease, or IBD, there's some inflammation that can be measured, seen, or tested for, either with a procedure like a colonoscopy or endoscopy, imaging like a CAT scan or an MRI, or even blood tests that measure inflammation. And in irritable bowel syndrome, all of these tests are relatively normal looking. Crohn's disease and ulcerative colitis are forms of irritable bowel syndrome, but having IBS and IBS symptoms does not lead to those conditions. It's always possible that over time, a patient may develop inflammatory bowel disease in the setting of IBS, but that's very, very uncommon. But what's also very common is that patients with inflammatory bowel disease, or IBD, may also have coexisting irritable bowel syndrome. We know that IBS does not lead to cancer. There's many, many years of data that demonstrate that very nicely. But it is important to know that if you have signs of rectal bleeding, fever, weight loss, a change in your symptoms, it's always important to tell your healthcare provider, because that may warrant additional evaluation at that time.